So we will move on to the next presenter, who's John Harris, and John is going to talk about global vitiligo and issues related to features on that. John?
Thanks, Harvey. I need to be able to share my screen. There we go. Again, happy to be with everybody here today from all over the world. Here we're going to talk about a survey that we conducted to try to answer the question of what the true prevalence of vitiligo is. This was a collaboration with Insight Corporation, and we initiated it because we thought that there was likely an underreporting of vitiligo. These are my disclosures. None of them is relevant to the current talk. The prevalence of vitiligo has really been estimated in a large number of studies, and depending on the geographical location and the population analyzed has been anywhere from 0.5% to 2%. Most of the studies actually report much lower than 1%, and it's likely that this is because not every individual with vitiligo actually goes to a doctor and gets counted. There is a lot of noise. I wonder if everybody can mute. Thanks. So unlike other autoimmune diseases like type 1 diabetes, where you have to go to the doctor and get counted or you die, vitiligo patients may or may not present to a physician and get counted. And so we thought that the estimated prevalence was significantly underreported. But it's a difficult question to answer. How do you get that true prevalence if subjects aren't going to be counted in the clinic? So to address this, we initiated a population-based survey in a large number of subjects online, and essentially asked whether patients were diagnosed with vitiligo or whether they had potential skin changes that might be consistent with vitiligo. And then once we had this, we asked demographic questions, and we also wanted to know whether they were managing their disease in some way. So this is the survey methodology. We started with questions asking whether they had any skin diseases. In particular, the subjects did not know that this was a vitiligo-specific survey, so we were just asking lots of questions. Were they diagnosed with any other diseases, autoimmune diseases, skin diseases? And we followed up with whether they had any conditions in their skin that might be consistent with that as well. So lots of questions. If they responded that they didn't have vitiligo and they didn't indicate that they had any skin changes that might be consistent with vitiligo, like white spots, their survey ended. But if they responded that they had vitiligo or any signs of vitiligo, they continued to a broader survey with more questions, including demographic questions. Now, we thought that the prevalence of vitiligo would be composed of three different groups. Number one, those who knew they had vitiligo and had been diagnosed by a physician. Number two, those who were pretty sure they had vitiligo based on the appearance of their skin and what they'd heard, but were not diagnosed by a physician. And then thirdly, those who were not aware that they had vitiligo, but they had skin lesions that might be consistent with that. And to get at this group, of course, we know that patient reports may be not reliable. And so we asked all subjects participating in the survey to send in pictures of their skin. And this was an optional activity. But it allowed us to really review the pictures and determine whether the subjects were correct. And as you can imagine, if they were diagnosed previously by a physician with vitiligo, they tended to have pictures consistent with vitiligo, so the majority of those. Whereas those who just had signs and did not know that they had vitiligo, many of them had other things, pityriasis alba and nevus depigmentosus and other signs as well. And so the photos allowed us to determine how correct these diagnoses were. And so in the vitiligo signs, it was about 13%. Those who had signs that might be consistent with vitiligo, when they sent in their photos, about 13% of those were actually vitiligo. And so it allowed us to correct our numbers based on those photos. And so how correct the prevalence of vitiligo was an addition of all three groups. Those who had signs that might be consistent with vitiligo, when they sent in their photos. There's an echo here. Someone's unmuted. Nilesh Goyal, can you mute? Our numbers based on those photos. And so those Thank you. So we believe that the true prevalence of vitiligo would be an addition of all three groups, diagnosed, aware, undiagnosed but aware, and then those who were unaware. And these are the results. So in over 35,000 participants, we noted that the prevalence of vitiligo was about 1.3% across all geographic locations. And this was made up of 0.6% of those who had been diagnosed by a physician. And this is really consistent with many of the reports out there that suggesting that those reports were based on those who presented to a physician. There were another 0.4% of those who believed they had vitiligo but had not been diagnosed, and then another 0.3% who did not know they had vitiligo but had skin signs of vitiligo. And this was, again, corrected for those who sent in photos and actually did have disease. So this 1.3% is much higher than the much less than 1% that's typically reported. In Europe, they had the highest prevalence, 1.6%. United States was 1.5%, and Japan was 0.5%. Of those who had been diagnosed by a physician, the majority had been diagnosed by a dermatologist, and particularly in Japan, where over 90% were diagnosed by a dermatologist. In the US, a good quarter of the patients were diagnosed, US and Europe, a quarter of them were diagnosed by their primary care physician, and some others as well. So the characteristics of the patients, the majority were under the age of 45. We know that vitiligo is initiated in the young. Interestingly, women represented 54% of the participants that were noted to have vitiligo. And I say that because we know in the clinic, those patients with vitiligo who present to the clinic are much higher percentage. They're around 65%, at least in my clinic. And we think that that's probably because women seek care more often than men. And I think that this survey really supports that, as the women were closer to a 50%. The majority were white and had a Fitzpatrick scale of 2 to 4, really. They had all disease activity, stable, active, progression, rapid progression. These were really scattered all over. And then, of course, we mentioned that our goal was really also to find out what their management strategy was, if any. And when we asked what they were doing for their vitiligo, 89% of the respondents used at least one management strategy. This included sun protection. That was the most common. Non-prescription oral medications were very frequently used, and these were really vitamins and or herbal supplements. Many used cosmetics to cover it up. And actually a large population were using prescription medications as well, prescription topicals, even surgery, other procedures. Prescription orals were 42% of the respondents, and some form of light therapy over 40%. So a lot of people were using a lot of things. The median patients were using 5 of these categories. So lots of desire to treat their disease. So we think that this study really told us a lot, actually, in that the prevalence of vitiligo is likely highly underreported for the reasons I mentioned earlier, and that the true prevalence is much higher than we had initially thought, at likely 1.3%. The limitations of our study is that we use the internet, so it required internet access to participate. That's a particular population of individuals, of course. And we relied somewhat on patient-reported outcomes, but this was verified by photos, and the data were corrected for that. So I think that did help a lot. You can think without these limitations, it's very hard to do a similar study. I used to joke that if you wanted the true prevalence of vitiligo, you'd have to set up a tent outside a supermarket and force everybody into the tent for a full body skin exam. I think that this is probably the closest we can get to that. We studied 3 large populations in Europe, US, and Japan. And as I mentioned, we think it's underreported. Lots of people want to manage their disease. And so we think that this vitiligo represents a significant unmet medical need that we would like to address in the future. That's it. If there's time, I'm happy to take questions.
Thank you very much, John. This is a wonderful overview. I think this is a nice, because you can gather a lot of information based on this kind of studies. Do you have other plans for the future within the same context?
Yeah, I think we should expand the study. You know, with 35,000 subjects, I think that's a good start. But we need to look at other populations. We certainly need to get darker Fitzpatrick skin types and a more diverse group to really understand. The question, you know, I would have is you know, Caucasians versus those of darker skin types. We'd be able to compare, you know, those who are requesting management and strategies to see if that's different, to see if beliefs are different in different cultures. Through a survey, you know, we can ask a lot of questions about burden of disease and desire for repigmentation. And so those are a lot of things that we could add.
Thank you. Did we receive other questions?
Yeah, there are a couple here. How patients were recruited. This was, again, not focused on a specific vitiligo population. This was just online. So those on social media would be offered the survey, and that they would have to choose to take it. Those using surgical procedures, it's unclear because we didn't ask specifics. It is very unlikely that that percentage of patients used MKTP. But in other parts of the world, lots of people are doing punch grafting and other things that are a bit simpler. And the primary reason undiagnosed patients didn't seek care, you know, it may have been that they were fair-skinned and didn't know that they had it. Sometimes they do know that they have it, but it's very focal and not bothersome to them. So those are a number of reasons.
John, there was a question about how representative do you think this group was of the general population? You know,
I think it's as close as we could get with an initial survey like this. Clearly, there were some skin phototypes that were not represented. 5 and 6 Fitzpatrick were underrepresented, I believe, particularly in the populations that we studied. Looking at Japan as a major population, they were pretty narrow in terms of their demographics. So I think that it's a great start, and I think it's true. I think most of us believe that the prevalence is much over 1%, despite earlier studies. So I think it's consistent with what we kind of thought, and really provides a good foundation for more studies.